they're raised with a bias of training that favors a very narrow approach as opposed to a more holistic or, funnel vision approach where you can see all possibilities.
Like, what is it? Because you have documented use cases and proof cases like the one you just mentioned,
right?
Where you're able to quickly, swiftly end a behavior that is potentially ruining somebody's entire life. Why do we take the other path first?
Why do people take medication? Because it's easier than trying to figure out what the real issue is. Part of it is just an entrenched, outdated paradigm. Why is it that when people are ill, that changing nutrition is not the very first thing they do before taking medications or whatever it might be? Think about how many medical doctors there are, how many psychotherapists there are, compared to how many naturopaths, nutritionists, or hypnotists. And not only that, there's a bias of training because the medical establishment has certain influences what's in the textbooks that medical doctors or that med students learn, and even people in pre-med programs learn certain things. So they're raised with a bias of training that favors a very narrow approach as opposed to a more holistic or, funnel vision approach where you can see all possibilities. Allopathic medicine is very useful in some contexts. Talk therapy is as well. Medication is as well. But so is nutrition, so is dealing with the subconscious, and I don't exclude those conventional approaches. I just feel like that should be part of the solution and not the sole solution.